The Digital Health Captains of Industry is actually one part of our broader Future of Healthcare program. And the Future of Healthcare program is an initiative by Deloitte to provide a neutral and inclusive environment for really hard conversations to take place between industry stakeholders. We really made sure that this was an unconference in the way that it was facilitated in breakaway sessions between some key stakeholders so that they could actually tackle some really topical issues.
Just get the conversation going, and if we collaborate around the various initiatives that are underway, I have no doubt that we can bring the good that comes out of every sector to find an overall and powerful output, which is driving accessibility to healthcare, reducing costs and improving patient outcomes.
I think the biggest issue would be to allow technology to address access. And that can come in various ways and forms. I think we've got a huge mobile penetration in South Africa, but a lot of it is still feature phone. So if you could use the feature phone as an entry point to the system, whether that be to schedule an appointment at a rural clinic or the GP or the hospital, to prevent the kind of queues that we see in the system at the moment.
So I think big data is a very important issue in healthcare because of the need to understand physiology. Unfortunately, people are incredibly complex, and to begin to put together the genomic information, the phenotypic information, their lifestyle information, and their response to healthcare, which is constantly changing as well, requires a combination of data sets, broad-ranging, high-frequency, daily information. It's going to be structured, it's going to be unstructured, and all of that data and all of those sort of various fields need to come together.
Technology is a tool that we apply to a medical or business problem, and we've got to get the various communities together to figure out how you apply that technology to get some kind of a solution or a better medical outcome.
So up to now, technology has been regarded as something that can strengthen healthcare systems, but what's becoming clear over the last few years is that technology, and particularly the information side of technology, really has the ability to transform a healthcare system, which means because that information is available, the relationship between doctors changes, the relationship between different types of care providers changes, and the relationship between care providers and the patients themselves changes. And it's that changing relationship and the changing setup, the working arrangements and the way people work together that transforms the healthcare system.